Imagine taking out your own appendix. You are in the middle of nowhere, no operating team, anesthesia, nurses, or electronic medical records. I'm Dr. Simpson. This is the story of Leonid Rogozov, and if you like medical history and surgical history, give me a follow. It was 1961, in the beginning of the Cold War, and Leonid Rogozov decided he was done with surgery, so he went on an adventure. Antarctica he goes. And then one day in Antarctica, he wakes up with pain, fever, and he knows he has appendicitis. The nearest hospital is 800 miles away, but you can't get there because you are snowed in Antarctica. He made the only choice he could have. He could either die or take out his appendix. So he had the operating room washed down meticulously, such as it was. He gets a truck driver, he gets a meteorologist, because who else can help you in the middle of nowhere, and an administrator is backup. He leaves him meticulous instructions. If I faint, inject me with his epinephrine, as well as 100 of other instructions that he left them. And then the operation began. One guy holding a mirror, one guy giving him instruments. He starts the Novocaine, starts the incision, makes a 12-centimeter incision, and goes down layer by layer by layer. He had to take a couple of breaks, one for nausea, one because he was feeling faint. And one time he had to take off his gloves, reach his hand into his abdomen like an Indiana Jones moment and pull out his appendix and deliver it and cut it off. Then he closed himself up. A week later, he takes out his sutures. 2 weeks later, he is back to work. Now, I love this story. I love the grit. I love the determination. And by the way, he went back and finished his surgical residency and was an amazing professor of surgery in the University in St. Petersburg. Today, we have better instruments. Today, because of Leonid Rogozov, we have people who actually have to have their appendix out before they go to Antarctica. Now, we can imagine going to the moon or going to Mars and needing this still thing. But here's something we also have. This story was brought to you by Fakes, and we have comfortable clothes. And he should have at least had comfortable clothes instead of those horrible whites you see in these pictures. Well, let me give you a little bit more of a real story. I spilled coffee on myself the other day going to the operating room, and I was able to go to the bathroom, wipe it off with a little bit of water. No water stain, no coffee stain, no long-term embarrassment, because the new Formex fabrics that they have are my favorite things to wear. They're the latest fabrics, they're comfortable, they're easy to wear, they wick away moisture. And at least if you're going to operate on yourself, you might as well be comfortable.